Hello, my name is Emily Weaver, and I have chosen to share about cinnamon as a dietary supplement. There are two types of cinnamon, cassia and Ceylon. Cassia is native to China, and Sri Lanka is home to Ceylon. Both are sold in the U.S. It has been historically used in traditional medicine and is even found in Chinese writings dating back to 2800 BC. It is used to help cure many things, even respiratory ailments. It was also used in ancient Egypt for embalming purposes. Of all the things we know about cinnamon, we do not know its mechanism of action in the body. We know that taking only a small amount as a standalone modality helps to reduce blood sugar, reduce blood pressure in some people, which is mainly those with diabetes, and probably reduces the amount of insulin that is circulating in the blood. Obviously, if cinnamon helps to lower blood pressure and blood sugar, it will aid in correcting hypertension and diabetes mellitus, especially type 2. Many also say that it helps with gastrointestinal issues, but there has not been much research on that claim. Cinnamon is contraindicated with liver disease, acetaminophen use that is taken daily, usually for arthritis or chronic pain, and statins. This is because the chemical coumarin that is found in cinnamon can cause liver damage when used in large amounts. The previously mentioned all would increase damage to the liver, which could be detrimental. Also, children and breastfeeding or pregnant mothers are advised to avoid this, only due to the fact that there's no research done on those demographics, and we don't know how cinnamon would affect those individuals. As with any kind of supplement, there are pros and cons. The first two pros I have listed have been previously mentioned in this presentation. The other two are important to note. It is an all-natural substance, so there's not extra unknown chemicals that are entering your body, as there would be the case in Western medicine with their drugs. Also, it is relatively inexpensive and can be purchased over the counter without any prescription. You don't even need insurance to buy this. The cons are things I believe can actually be controlled. If you watch the amount that you are taking and refrain from its use during nursing, the liver damage and the tumor growth can be avoided. Liver damage and tumor growth are both linked to large amounts of coumarin, which is in cinnamon, not the cinnamon itself. Cassia cinnamon actually has less coumarin, if that is a big concern for you. Some of the side effects are liver damage, tongue swelling or mouth sores, hypoglycemia, and trouble breathing. The most dangerous and uncontrollable side effect is the tongue swelling. This can be very dangerous, and those who react this way most likely will not know they have a problem until they ingest it. The other issue is breathing trouble. This is usually caused when cinnamon is breathed in. It causes the lungs to become inflamed and can be very scary. The general public is skeptical of cinnamon, although they do have a willingness to learn and they are very curious. Medical professionals agree with the use of natural substances to help control medical conditions, but many of them worry that the patients will rely too heavily on these supplements and put their health at risk if they completely stop taking their other prescribed medications. As for how many people take this, we don't know that at this point. As in Western medicine, research is always being done on natural substances as well. In 2013, Aiklin, Pimlott, Tasami, and Robinson conducted a study on the short-term effects of cinnamon on blood pressure in patients with prediabetes and diabetes type 2. Their study found that it did show a decrease in systolic and diastolic blood pressure for that patient demographic. Some other studies have found that it reduces systolic blood pressure in those without diabetes of any kind, but this study did not report on that aspect. They also did not study any long-term effects and noted that at the end, although their study did show a significant change in blood pressure, they're unable to recommend its use due to the lack of studies with similar findings. Because cinnamon can be found over the counter and does not need any special training to use, you technically do not need any level of education to use this. Although there are people with higher education, such as medical doctors or holistic practitioners, that may recommend this to their patients. The following questions will help you to review the presentation. Which major organ can be affected by an excess of cinnamon? Is there evidence to support the use of cinnamon to lower blood pressure?